करता हूँ।
धन्यवाद। श्री डी प्रसाद राव जी, श्री डी प्रसाद राव, मिस्टर राव, डी प्रसाद राव।
Thank you, Honorable Speaker, sir. I rise today to express my views on the Health Security National Security Cess Bill 2025, a landmark legislation introduced by our dynamic and visionary Honorable Prime Minister Sri Narendra Modi ji and our esteemed Finance Minister Srimati Nirmala Sitharaman ji. At the outset, I wholeheartedly commend the Modi government for again placing public health, fiscal prudence and national security at the center of national policy making. The bill is not just a financial reform, it is a moral commitment to safeguard the health of our citizens and strengthen our nation's security architecture. For years, India has struggled with the devastating social and health impact of tobacco, pan masala, vodka and similar harmful products. The economic burden on our health system is enormous. The NDA government recognized this challenge early and has implemented several deterrent measures. Now the phase out of GST compensation says the government has taken a foresighted decision to impose the health security national security cess, ensuring continuity of revenue from sin goods, protection of public health, financial stability for national security infrastructure, and a strong deterrent against harmful consumption. This step reflects strong governance, long-term thinking, and the courage to take decisions that put nation above politics. Sir, the bill aligns seamlessly with the government's sustained commitment to public health. Over the last decade, the government's share in total health expenditure has risen from 29% in 2014 to 48% financial year 2022, a significant increase in public investment. So, the transformative initiatives such as Ayushman Bharat, PMJ, which covers nearly 55 crore individuals and has established around 1.7 lakh functional health and wellness centers, reflect the government's focus on universal and equitable health care. By securing dedicated funds through this bill, we further strengthen the foundation of a healthier and safer India. However, sir, despite these important strides, the nation continues to grapple with serious health challenges. Anemia remains widespread, affecting more than 2/3 of children and nearly 60% of adolescent girls, while 3 out of 4 women still have low dietary iron intake. Equally worrying, hospital data from 2020 to 23 shows that half of the heart attack patients in India are under the age of 40, pointing to sharp rise in early onset cardiovascular diseases. We are also witnessing a rapid increase in overweight and obesity among children and adults alike, signaling an emerging nationwide health crisis. Chronic non-communicable diseases, heart disease, diabetes, respiratory ailments, and cancer now account for nearly 2/3 of deaths in India, up from less than 40% in 1990. Sir, it is in this broader context, the cess-based funding has become even more crucial. So yes, sir, we must also recognize that health challenges vary significantly across states. Andhra Pradesh, for instance, has the second highest HIV burden in the country, with 2.75 lakh cases. Nearly 59% of women in the state are anemic, communicable, maternal, neonatal, and nutritional diseases contribute over 25% of the state's total disease burden. These realities highlight the need for targeted, state-specific interventions backed by the adequate resources. So, apart from this, there are some concerns for this bill. Hope the Honorable Finance Minister will clarify on this or clarify to the House on this. So the concerns, major concerns are, because the cess proceeds are not shared with the states, there is opposition from some quarters. States or political parties may argue that such revenue centralization harms federal fiscal structure. And calculating cess based on machines and processes rather than output might be a complex and may increase compliance burden on small manufacturers or units. If the government uses the cess for broader national security pending, there might be a less direct transparency about how much goes to health versus security, which can raise accountability concerns. So with this, I support this bill and commend Finance Minister to have introduced this bill for the safety of the health and security of this country. Thank you very much.
Shri Sanjay Deshmukh ji.